Mindfulness and ADHD. Attention is a window to our daily experience and a foundation of our awareness in life. Where and how we place attention, or where and how other things grab our attention, determines the quality of our lives, relationships with others, and most of all, the relationship we have with ourselves. What we know about ourselves, how we feel inside, and our ability to grow and change are all influenced by the placement and the quality of our attention. This relationship between regulation of attention and well-being is shown in a condition called attention deficit hyperactivity disorder, also known as ADD or ADHD. As a psychiatrist who specializes in adult ADHD, I often get the question, what is the difference between ADD and ADHD? These terms can be confusing even to people who've had the diagnosis for a long time. In general, ADD is a casual way to mean ADHD, especially ADHD without hyperactivity. ADHD is a more precise and inclusive way of referring to this condition. On the following tracks, I will use the inclusive term ADHD when talking about all types of this condition. While we all can feel inattentive at times, some people struggle with it most of the time, and about 7 to 9% of children and over 4% of adults in the US are diagnosed with ADHD. If you have ADHD, then problems with attention, disorganization, restlessness, impulsivity, and forgetfulness create a lot of difficulties in your life and can stop you from reaching full potential in school, work, and relationships. Overall, ADHD leads to difficulties with self-control or self-regulation. Here's an example. 1 minute, you may be getting ready to leave home for a work interview, but an incoming email grabs your attention. You start reading your emails and lose track of time only to realize that now you're late for the appointment. You berate yourself for getting distracted and panicky to get going. Feeling frazzled, you rush out of the door without your resume. The whole day becomes very stressful as you try to make it to the meeting already late. This ADHD cycle can repeat and lead to chronic stress, self-doubt, and even more difficulty getting things done and reaching your goals. Since ADHD is a problem with self-regulation, tools to improve self-regulation can be of great help. Mindfulness, a type of mental training derived from long-standing meditation practices, is one such powerful tool. I invite you to explore mindfulness as a way to understand and manage symptoms of adult ADHD. So what exactly is mindfulness or mindful awareness? In everyday language, the word mindfulness often means remembering to be aware or attentive. For example, being mindful of our footsteps when carefully crossing a stream on slippery rocks. So all of us already have some experience with mindfulness, which is a universal capacity of our minds. One good way to think about mindfulness is that it's an intentional process that involves 2 steps. 1, paying attention to what's happening in the present moment. And 2, doing it with a specific attitude, an attitude of openness, curiosity, and acceptance. This specific way of paying attention can be applied to anything that's happening in the present moment. For example, an external thing, a flower or a raisin, other people, or yourself. When applied to yourself, Mindfulness expands your awareness of the inner world by non-judgmentally observing attention shifts, thoughts, feelings, body sensations, or your actions. Such observing of the mind and body leads to discernment and can expand and inform your choices in life. Most importantly, mindfulness can be applied to working with and transforming your ADHD symptoms. Automatic pilot. A common characteristic of the human mind that mindfulness works with is automatic pilot. Being on automatic pilot happens whenever we get absent-minded or preoccupied with our thinking. It is the opposite of being mindful or attentive. At any point, when you're mechanically doing a routine or habitual activity, like eating or driving, for example, you can easily slip into the automatic mode or do things without being fully aware of doing them. Stress and intense emotions can also kick us into this mode, and daydreaming, common with ADHD, is another example of slipping into the autopilot. When on autopilot, you often can do things out of habit and never ask, do I really have to be doing this in this way? Like daydreaming, other ADHD symptoms often arise from a state of autopilot without full awareness. Through mindfulness, you can notice the ADHD symptoms as something to be curious about, something that can be observed non-judgmentally, without being overly critical, but also without ignoring the problem. Once you observe in this way, you have a choice to work with the problems more compassionately and more effectively. In other words, you create more self-awareness and new opportunities to successfully manage your ADHD. Increasingly, the benefits of mindfulness are being demonstrated through scientific research. Mindfulness training is shown to help with chronic pain, stress, depression, anxiety, and addictions. It also leads to a balanced mood and a greater sense of well-being. The neuroimaging research shows that meditation can positively impact the neural circuits involved in attention, cognition, and emotion regulation. For example, long-term meditators show enhanced functions of the prefrontal cortex, an area of the brain also important in ADHD. Such studies point to the quality of the human brain called neuroplasticity, or the ability of neural circuits to be changed by the repeated actions of our minds and our behavior. In other words, what we pay attention to and how we pay attention can influence the function and even the structure of our brains. My personal experience with mindfulness has taught me that mindfulness is an invaluable tool for attention and emotional wellness. And as a psychiatrist, I wanted to use this approach for adults with ADHD. At UCLA, I led the development of the Mindful Awareness Practices, or MAPS, for ADHD program. Our program was tested in a pilot study with a group of adults and teens with ADHD, and found that after 8 weeks of training, many participants performed better on several attention and cognitive tests and reported less symptoms of ADHD, anxiety, depression, and stress. These findings are in line with other research showing that mindfulness is related to better attention and self-regulation. In the following tracks, I will introduce you to exercises used in this study as well as in my clinical work with adults with ADHD. In weaving the practices on these tracks into your daily life, you train attention and become more aware when the ADHD symptoms are occurring. You create opportunities to change the habitual mind and behavior patterns that no longer serve you. Through this practice, you can increase your focus, develop more control of negative feelings or impulsive actions, and become more compassionate to yourself and others. More present to each moment, you will be empowered to thrive with ADHD.